Hi everyone, welcome to the APHA Operation Women's Health brief training video. This will help you understand what we want to cover during our health fairs. So we just recently printed out a poster. We have 4 topics on our poster: HPV, breast cancer, yeast infections, and endometriosis. We picked these ones because we thought that these applied to the community the best. We also talk about breast cancer. We'll let women know that it is the most common type of cancer after skin cancer, and we want to tell them about their risks. The biggest ones being genetics, family history, alcohol use, being at an older age, being obese, never having children, if you have hormonal therapy after menopause, and there's also more. And we want to let women know that they need to start getting their mammograms annually at age 45, and then they can go down to twice a year after 55. But if they feel like they have more of these risk factors, they can continue doing annually after 55. And we also want to let them know how to do a self-breast exam. We want to let them know that they should be doing these monthly, preferably 2 to 3 days after your period. It's easier to do it in the shower whenever you have like soap on your hand. It's easier to feel things. You just have to lift your arm above your head and palpate your breast, and we can help demonstrate that if we need to. And another thing we talk about is yeast infections. Because yeast infections are so common, they affect 3 out of 4 women at some point in their life. We thought it would be smart to give them some information regarding yeast infections. So we want to let them know that the symptoms are red, itchy, sore vulva, burning while urinating, and a thick, white, odorless discharge. And the biggest way to prevent yeast infections is to avoid having that area wet. So you want to avoid hot tubs because bacteria like moist heat. You want to avoid sitting in wet clothes for too long, or wet or sweaty clothes. You also want to try to avoid scented feminine products, so stick with unscented things. And again, don't use unnecessary antibiotics. We know you shouldn't use this for other reasons, but it also kills your flora and can cause yeast infections. And with endometriosis, this often goes undiagnosed in women because the symptoms get mistaken for just regular menstruation symptoms. But it's estimated that it affects 11% of American women. This statistic could be flawed because it goes undiagnosed so often. It's caused by uterine-like tissue growing outside of the uterus. And the symptoms of this, like I said, get brushed under the rug sometimes. They include painful periods, pain during sex, digestive problems. You could have painful bowel movements. This is a big thing that causes infertility in women, so this is a good talking point for many people. Endometriosis also causes fatigue and heavy periods. The treatment options we have are just NSAIDs for pain management, and they should be taken on a continuous cycle during your period. And probably the most common is using hormonal contraception to either decrease the number of periods you have in a year or to totally eliminate your period. And if you have severe symptoms after all this, there is surgery available. And with birth control, we talk about this separate from the poster just because there's so much that you could talk about. Well, there's a lot of women out there that are on birth control. There's a lot of people that want to switch up their birth control. There's a lot of people that are just interested in starting it. So we have to really know what we're talking about to best help the patient. So the most common form of birth control is probably the pill. And the big thing to remember with that is there's progesterone only, and there's a combo with progestins and estrogen. And progesterone only sometimes is best for patients, including patients with migraine with aura. If you're over 30 and a smoker, you want to use progesterone only because the combo pills come with an added risk of thrombosis. So just that risk alone is something that you want to tell people about if maybe they're concerned about that. But that thrombosis risk increases with smoking, so that's why you want to put those people in progesterone only. But that's a conversation they can have with their doctor anyways. And also you want to, maybe you could ask about adherence at this point. If they forget to take pills all the time, maybe you could recommend an implant device or a hormonal or non-hormonal IUD. And another important thing to tell people is that condoms are the only form of birth control that can prevent STIs. And this is the birth control guide. It's a fold out. We got it from the FDA. We have them to hand out to people. It's good to have this whenever you're going over their options with them, because it lists all of the methods, it lists how effective it is based on the number of unwanted pregnancies per 100 women. It tells you how to use it, and it tells you some of the risks and side effects like I was just talking about. And they can take this home with them. And we also have a few models. This is just a basic model of a pelvis. Here we could demonstrate how to use a female condom or a diaphragm or stuff like that. And then here we have an IUD insertion model. This just helps people visualize what actually an IUD is. It lets them realize it's not super invasive. It won't interfere with sex or anything. So this is important to have that. And then here we have a model that's just better anatomy. It's more in depth. Here we could really point out more things about endometriosis on this model. We have more flyers that we hand out. This is just women with HIV. It lets people know like how HIV is transmitted, what to do if someone has HIV, and that you should be tested if you think you might have it. And we also have information about osteoporosis, so we're trying to incorporate all age groups of women. So osteoporosis is mainly women over the age of 50, so you can target them and ask if they know their risks. Their risks include having a low body weight, smoking, family history, not getting enough exercise, drinking more than 3 drinks a day. And we can let them know that it's diagnosed with a DEXA scan and there's not an actual cure, but we could help manage things. Okay, all right, and that's it. Thank you for your time. And let me know if you have any questions. Now, what we want to tell the people that visit our health fairs about HPV is we want, first of all, to tell them how it's transmitted. And it's transmitted through sexual intercourse, vaginal, anal, and oral sex. And the best way to prevent it is with the HPV vaccine and using condoms. And we also want to let them know how important the HPV vaccine is, because HPV is the most common STI. And we have information about the dosing schedule. If they have more questions about that, we can send them over to Operation Immunization if they're there.